Good morning, good afternoon, and good evening. Welcome to the 1013th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you. Today we have with us Dr. GURUKIRAN. In fact, he needs no much introduction. He's a very popular person. I think one of the most important, most noticeable personality from young talented physicians who participate in the program. Anyway, for completing the formality, have graduated BHMS from Government Homeopathy Medical College Hospital, Bangalore, classic homeopathy practitioner in the district of Chamarajanagar, state of Karnataka, India. 15 years of clinical experience. Lot of topics are there because his talks is very important. Each and every minutes is important. So just the topic is conversion of patient language into rubric part 2. On behalf of IFPH, I welcome Dr. GURUKIRAN. You can have the platform for the next 40 minutes. It's over to you.
Thank you, sir. Thank you for the introduction, sir. So is it visible, sir?
Yes, yes.
Yes, sir. Is it now visible, sir?
Yes, no problem.
Yes, sir. Okay. Yes. Today's topic is conversion of patient language into rubrics. That is part 2. So last session, I spoke about the conversion of patient language into rubrics, the part 1. In the last time, I have mentioned about some of the introductions and what about the stalwarts says about this have shown in the last session. Yes, today the part 2 I'm going to take up now. Yes, before that, I would like to take blessings from Dr. Samuel Hahnemann. This photo is Dr. Hahnemann's as a treating physician. Now, yes, in the last class, I would like to just brush a few points. Each and every homeopathic practitioners will refer repertory in cases. Yes, in repertory, we have got huge number of rubrics. Especially in the mind chapter, we have got lot of important rubrics. Here, the homeopaths fail in interpretation of the rubrics and understanding of the rubrics, which has to apply to the case. First point. Second point, each and every rubric in the mind chapter or which is ambiguous and implicit, which is very difficult to understand. And the third point.
Excuse me, Dr. GURUKIRAN. There is
As I said,
problem, I think.
It's very interpretation of the applying of the rubric, which it is not rather lack of understanding of how to apply, then it is necessary to take into consideration. When it is not, what can we do? When it is not present, then they use the strong homeopathic symptoms and try to find the similar one. So in this session, I would like to present the mental symptoms and its understanding and interpretation with remedies. Second thing, when there is no any mental symptom in a case, then we should think of very strong homeopathic symptoms. That points also I would like to present in this session. Some of the rubrics which is directly related to the case. How can we interpret that? And how can we see in that to present in this session? when these two things are here and the session is, let's move on to the rubrics now. So this is a common here in our clinical practice. That is, so we should inquire that the patient is okay. In our clinics, this is very common symptom. Then we should be aware to inquire that if the patient is stressed mentally and emotionally. If the two things are there in a case, then it is easy to search in a repertory, especially in the complete repertory. There is a rubric called as stressed mentally and emotionally. Both the things are considered. The major remedies, that is carcinosin, coca, naxomica, and tuberculinol. So this is one of the major rubric what we can find it in the complete repertory, also in our daily clinical practice. And the second rubric is sensitive to opinion of others. If the patient says, sir, if anybody speaks in front of me, anything about me, I'll become very much disturbed. What does it mean? That is, the patient is sensitive to any kind of opinions of others. If there should not be any critics, if they give some opinion, it may be negative or it may be positive, the patient becomes very sensitive. This is the point where we should consider the rubric, that is sensitive to opinion of others, that is indignation. The leading remedy is staphysagria. When you think of indignation, we should not forget the remedy staphysagria. And some of the patients may ask in the clinic, sir, this time also do you prescribe the same remedy? Again, the same remedy, sir, again for me? Definitely we have encountered these kind of patients in our clinic. Change desire for. The patient is desired to change the remedy. There is a rubric in our repertoire. That is the wonderful and depth of our remedy. Change desire for. That is Bryonia, Calcarea Force, Heparsulf, Merxol, Pulsatilla, Salicula, and Tuberculinum. These are the major remedies. In these slides, I would like to show only the major 3 or 4 mark remedies. There will be some of the 1 mark remedies also that you can refer it in your repertory slides. But only I would like to present only 4 and 3 marks remedies. And severe pain, everything is severe. If there is any mild pain, the patient will present in the clinic, sir, very severe abdomen pain, sir, very severe abdomen pain, sir. So this is the patient is exaggerating the symptom. This is very, very key. This is these expressions and these symptoms when they present in our clinic becomes very important to consider. So exaggerating. So the major remedies is asafoetida, chamomilla, nux moscata, plumbum, lycopodium, and platinum. So I have every disease. These kind of patients we may see in our clinics. Sir, every disease, the patients start to narrate the symptoms from head to toe. Sir, I have a headache. Sir, I have eye pain. Sir, I have a problem in my nose, and there is problem in my mouth, and there is problem in my neck, sir. Some of the things have pains. There is cervical pain, sir, when I sleep. Then also there is shoulder pain, sir. The chest pains are also abdomen pains are also legs pains, sir. Some of the time I'll get pain in my toes, sir. From head to toe, they'll describe the symptom. I have every disease. Whatever you say, I have every disease the patient will get. This is delusion disease. Every disease he has. Aurum mu and stramonium is the main leading remedies. And let's move on to the next slide. This is also very important, very interesting. Patient says all investigations normal. If you ask an investigation, sir, everything is normal, sir. Have you checked it? No, sir. Last month I have checked it, sir. Everything is normal, sir. That another doctor said, the perfectly all right. All the reports are normal, sir. Let me show your report. If you ask, then they'll show you the report. Then the report is HbA1c 11. He's a liar. So we can think of, not in each and every case we should think, but if there is a very striking symptoms regarding this, we should think of he is a liar. The main remedy is alcoholus, morphinum, opium, and veratrum. And do we all know that Rajiv Gandhi assassination? What are the people? They are LTTE people. What they call it as a single word rubric, anarchist. Anarchist. What are the remedies which comes to anarchist is Marxol, argentum nitricum, and you may think causticum. Causticum in another phase, it is very sympathetic, very friendly, and they can't tolerate injustice. The causticum. But here, they may also become anarchist, the extreme, the two poles of a remedy. Rajiv Gandhi assassination is anarchist. And I was planning to consult you from past few months. Procrastinate, also called as postponing. This we may see in our clinic, sir. I would like to see you from since few months, sir. Some patient told me that he's a very good doctor. Go and meet him. But I was trying to meet you since 6 months, sir. I was trying to meet you since 3 months, sir. So you can consider the break, procrastinate or postponing. Also, we may have the chance to confirm it through other symptoms. That is, you may ask, what is the work schedule? The work schedule of the patient. In all these circumstances, the patient will be postponing their work. If they think, I want to do this today, then they'll think, I'll do it tomorrow or day after. Like that. All the work, whatever they do, they will be postponing. If somebody asks something in the home, he'll say, okay, I'm not able to do it today. I'll do it tomorrow or day after. Like that. Everything. Whatever the work the patients assigns, they will postpone it, procrastinate. Lycopodium is the leading remedy there. Like Lycopodium, carcinosin, and Silesia. In one of the cases, I have prescribed Lycopodium in one of the patient. That the patient used to postpone everything. He was a teacher. He used to postpone. If you want to give the notes to the students in the class, he'll say, I'll give it tomorrow. I'll give it day after tomorrow. Like that. Anyone in the office also, if he wants to go to somewhere or in the home, he'll say, no, I'll go it tomorrow, not today. I'm not well. I'm not feeling good. So this is postponing. Lycopodium did well to that case. And persistent in doing something difficult or delay in success. That is perseverance. What it is called as, in Kannada, we call it as chala. Chala bidade maduvavanu. Chala. I don't know what is the word in Malayalam. Persistent in doing something difficult or delay in success. Perseverance. That is Silesia, Calcarea, Calicar, Lactaninum, Lycopodium, and Nexomica. And always serious and formal. Never watch jokes. Frivolous. It will be very serious. You crack jokes in front of them. If you say any jokes pertaining to anything, they will not laugh. It will be always serious. They will be always serious. That is frivolous. Merck, Pulsatilla, Apis, Arnica. And careless in walking, crossing roads. This is seen while going on the road, while driving, while riding bikes. Some of the persons will never see the sights. They will cross instantly. They'll come suddenly in front of you. They'll cross the road. They are heedless persons. The main leading remedy is Baratakar, heedless thing, and also causticum and opium. And husband has poor money management, wasting money. That is squanders. He'll earn something and he will not give it to the wife or to the home for their family management. He'll waste it money by playing lottery, by paying casinos, giving it to the pub, giving it to friends. He will be suffering in the home. The home management will be very poor. Also, being that he will waste money by spending a lot of money to other things. That is squanders. That is Maxol and Nexvomica. 2 remedies. And child always putting finger in the mouth. We can see in the clinics that if you ask something, the child will do like this. Always child. If you ask something, if the parents take out his finger from the mouth, he'll shout. He'll shout. And always again, he has to put finger in the mouth. That we can take it. If the rubric confirms, if the patient tell about this, and if you observe this in your clinic, then you should make a confirmation of it. Then we can consider this rubric. Ipecac, calcarea, chamomilla. Chamomilla comes out very well. Natrum mu, silicea, and phosphorus. Thumb sucking. Always the babies used to thumb sucking. Some parents will complain, sir, please, do you have any remedy for this to release this thumb? Always she will be thumb sucking while watching TV, watching mobile, and also while eating something and all. If you scold him, if you scold the children, the child used to suck the thumb. That is chocolate. Chocolate is one of the leading remedy for thumb sucking. In one of the lectures of Dr. Profil Vijaykar, Dr. Vijaykar has said one of the major cause for thumb sucking in children is very anxious pregnancy. If you ask the mother's history, pregnancy history, the mother will be in anxiety all through his pregnancy days. That will lead to thumb sucking children. So this may confirm when you ask the mother's history if this kind of patients comes to you in the clinic. Cement allergy. Skin urticaria cement. There is a direct rubric here in our repertory. Skin urticaria from cement. That is calcarea. Petroleum works wonderful in these kind of cases. I have used it. Rustox, also it's a very wonderful drug. And silicea. Euthanasia. What is euthanasia? Mercy killing. Euthanasia. Clinical euthanasia. We have got this remedy, that is CarboH. We should be very much aware in extreme cases, especially in when you're treating a very deep pathological case, which is very serious, which is very critical, which is critical in nature. When you treat a case, the CarboH should be administered very, very cautiously. If the symptom similarity, if the totality matches the symptomatology, only if there is a striking peculiar symptom, we can think of CarboH. Otherwise, if you give CarboH as casual in critical conditions, it will lead to clinical euthanasia. You should be very much aware. And gluten intolerance. Who are all eaters of chapati. If there is allergy after eating chapati, you can think of gluten intolerance. That is Bacillus gartner. It's a bowel nosode. I have not used it. I don't know about this experience, but there is a specific rubric in the repertory regarding bowel nosode, that is Bacillus gartner, gluten intolerance. And hormonal hypofunction. We can think of in a patients where endocrinological problems, where the patients present with the reports of hormonal assays, where there is a clinical hormonal hyperfunction. We can think of pulsatilla. And constant urge to blow her nose, but there was no discharge. This we can encounter in our practice. Some of the patients will tell that, sir, I used to blow my nose constantly. No discharge comes out from the nose, but I feel cold. That is nose, coryza, discharge without. Only three main remedies. Agaricus, bryonia you can think of because due to dryness, and calcarea. All the three very good remedies. Plantar fasciitis, which is very common in our clinics. So there is a pain in my soul since many days. When I wake up in the morning, I can't leave my foot down from the cot. I will have severe pain in my foot. That is plantar fasciitis. You may think of when you examine with a knee hammer, when you tap on the ankle region or in the sole, around the sole, the patients feel very much pain. That is, you may think of plantar fasciitis. And if you send for investigation, general X-ray, digital X-ray, you can have the diagnosis plantar fasciitis. extremities, inflammation, soles, fasciitis, plantar. This is the rubric we get in our repertory. Pulsatilla is the leading remedy. Pulsatilla acts very well in these kind of cases. And also, we have commonly in our clinical practices, that is calcaneal spur. In the X-ray, clearly we can see there is a bony outgrowth in the calcaneal region of the heel. That is calcaneal bone, that is calcaneal spur. What we can search in our repertory is exostosis heel. Medorrhinum is the single remedy. I have used it, medorrhinum, in the majority of the cases, not blindly, but after giving some constitution medicine, if there is any blockage or if there is a status quo in the improvement of the condition, you can think of medorrhinum. One single dose of medorrhinum will clear up the case. It's very, very important. And complaints after weaning in children. Generalities, weaning, that is China, chocolate, pulsatilla. It's a very common complaint. After weaning, the complaints in the children will be very common. You can think of this, China, chocolate and pulsatilla. And child has recurrent fever. What can we do in that case? We have the rubric, fever, relapsing. China, chocolate and pulsatilla. And basis on the totality of the symptom, we can match the remedy. Which one has to be prescribed? That is, it may be China, or it may be chocolate, or it may be pulsatilla. And this is a clinical condition, that is asphyxia neonatal. There is a separate rubric in the respiration chapter, asphyxia newborn infant. Antiemtat, camphora, laurocerasus. So 3 major remedies. This is also very important common symptom which females present in our clinic. Sir, back pain after my C-section. We have encountered this. Sir, there's severe pain, sir, after my second delivery, after cesarean section. There is a rubric. That is a wonderful and beautiful nature of our rubric, nature of our repertory. Back pain, sacral region, instrumental delivery after. That is hypericum. Only single remedy. You can also think of for forceps delivery, also for C-section. Both the things, hypericum. And bold resistance to an opposing force, that is defiant. You can think of some military operations, some military persons who may come into your clinic. Bold resistance to an opposing force is defiant in nature. Causticum, arnica, lycopodium. And the complaints from wisdom tooth. The adults may complain, so there is a pain in my wisdom tooth. So there are a lot of things, that is teeth, wisdom teeth, ailments from Shailisha, Chaumila, Marksol. Marksol works beautifully. I have my own experience. I also had some pain while my wisdom tooth was erupting, and I took Marksol, only a single dose. Within a matter of 2 hours, beautifully, magically, I have recovered after taking Marksol. Teeth, wisdom teeth, ailments from. Let's move on to the next slide. That is, child refuses mother's milk. This is also very important and very common clinical condition. The mothers may complain that child is refusing mother's milk. Just mild milk, child refuses. That is a spelling mistake. Just milk, child refuses. You can think of calcarea falls and silicea. And difficult to comb hair in shape. This is a problem of teenage girls. Very difficult to comb my hair in the shape, sir. Is there anything in the homeopathic, sir? Yes, we have got some answer to this question. Head, hair, bristling. That is Barretta-Carr, Laurocerasus, Ranunculus bulbosa. Head, hair, bristling. You can think of Barretta. It's a very important and good, very wonderful drug. And diarrhea from tender mango. Now there is a mango season. It's going on. Diarrhea from tender mango. Rectum, diarrhea, fruit unripe. Very beautiful rubric. Diarrhea, fruit unripe. Ipecac, acid phos, acid self. If there is very prostration, if you encounter a patient say, after going to diarrhea, I feel very weak. It's very, very weak, very prostrated, that you can think of acids, acid phos, acid sulfuric acid, and you may think of ipecac also, if there is any associated vomiting. And dactocystitis. What is it? Dactocystitis. That is eye inflammation, lacrimal sac. Is the inflammation of the lacrimal sac. We have a direct rubric, dactocystitis. Also, eye inflammation, lacrimal sac. Heparsulf, Merxol, Dulcamera, Pulsatilla. So both the things I have showing in the today's session that the mind symptoms which is difficult to interpret, and also some clinical conditions which is directly we can refer to the repertory. And a wanderer, no residence, move aimlessly. If you see these kind of persons around your clinic, we can think of Pyrrhus corpus, vagabond. What it is called as vagabond. Next, move on to the next rubric. He lost his erection while having intercourse. What it is? This is a very common clinical presentation we encounter in our clinic. If the couples come to in our chamber, they'll say these kind of, especially newly married couples. Erection wanting, caution during. There's a rubric, erection wanting, caution during. Argentum nitricum, camphora, graphitis, acid phos. Here, graphitis works very well. Have experienced graphitis in these kind of conditions, and also acid phos. And also back pain or the weakness in the back. His back was weak and he noticed the problem after having sex with his wife. That is back weakness, caution after. You can think of this rubric, natrum phos, selenium, calcarea. I have used calcarea and selenium in these kind of cases. Both remedies has acted beautifully. Back weakness, caution after. And word is deja vu. Some of you have experienced the present situation. That is called as deja vu. There is a separate rubric in our repertory. Also, there is a Kent repertory also. Deja vu, calibrome, and positron. Positron is a imponderabilia. Medicine which is prepared from natural energy. Positron. Feeling of having already experienced the present. It's a French word. Deja vu is in French word. Urination double stream. Bladder urination fourth stream. And a few, I think, last in the month of April, I have presented a case of double stream urine in this same platform. And there, the condition what have shown, it was the three major causes. It may be prostatomegaly, or it may be cystitis, or it may be due to any renal obstructions. I have shown all the conditions. There you can think of the rubric bladder urination fourth stream. Mercor thuja. Also another remedy is prunus spinosa. Prunus spinosa. Bladder urination fourth stream. These are all very syphilitic, very PQRS symptoms. If you encounter this in the clinical practice, directly go to the repertory, take the rubric, help of the rubric, and prescribe the remedy. Definitely will get the result. She woke up with migraine with flickering before her eyes in the morning. That is vision, flickering, headache during. That is China, cyclamen, natrium. In the migraine cases, we may encounter this symptom. After getting up in the morning, again, the headache is continued from the previous day. And there was some flickering in front of my eyes. Some light flickering in front of me with migraine. Just there is a separate rubric, vision, flickering, headache during. China, cyclamen, natrium. According to the case totality, we can prescribe. And if somebody guests come to the home, or if some strangers come to the home, children becomes shy and would like to hide behind the furnitures, behind the sofa or behind the door or behind the TV cabinet and all. So what is this? Hiding. If the children does it repeatedly, and you should confirm with the parents by asking, is that true, and is there any link to the clinical condition, or is there any striking features? If that is the case, you can think of hiding. The major remedies are arsenicum album, cuprum metallicum, baretacar, and think of skin worms. Some worm is crawling under the skin, or I feel that, sir. I feel something is crawling on my body under the skin. When think of skin worms, cocaine hydrochloricum, arsenicum, marxol, atrancar, selenium, silicea, and sulfur. You may think of cocaine because it may have doctrine of signature when the person have cocaine as a drug, he may experience these kind of symptoms. So can think of this cocaine hydrochloricum in these kind of cases. And this is also a very, very important clinical tip. When well selected medicines fails to act in acute diseases, what can we do? Remedies fails to act in acute disease. Only single remedy rubric, that is sulfur. Remedies fail to act in acute diseases. Single remedy rubric, sulfur. I am very sensitive on others, say, especially affection, reputation. This is important. Sensitive, external impression too. Here, in the last slide, I have shown you about the oversensitiveness. That's staphysagria. That is indignation. This is, I'm very sensitive to others, especially affection. When it is related to affection, reputation, you can think of sensitive external impression too. It is coffea, lysinum, marxol, and phosphorus. So two different approach of same kind of expressions from the patient side. This we have to interpret and convert the patient language into rubric according to the repertoire. Yes, parents of a child died. If some of the patient explains this kind of situation in front of you, parents of the child died due to some accident or due to any disaster, lived in orphanage. The boy or the girl lived in orphanage, and again there's a quarreling with the warden, thrown out from the hostel. Later, the patient becomes alcoholic. What it is? Ailments from punishment. Also, we can think of if there is any severe punishment in the school, daily the teachers used to punish the child, sending him out of the class due to his mischievous activities. Later, he may become alcoholic in his college days or in school days, in high school days. We can think of ailments from punishment. Ignitia, staphysagria, carcinosin. The carcinosin is the leading drug here. You can think of carcinosin, also staphysagria, then ignitia. And wife always abuses husband in front of the children. Many of the patients may say, the clinic, wife always abuses. The husband will complain, not the wife. Husband will complain, sir, always she'll be abusing me, sir. When I come from office, after getting very stressful job in the office, after getting scolding from my boss, when I comes to home, she abuses me. Wife abuses husband in front of the children. That is abusive. After listening to this, insulting, children will insult parents. We have the remedy, that is platina and scorpion. Abusive, insulting, children insult parents. When this kind of environment created in the home, children will be observing all these things. In some of the time, children will insult the same parents because they'll be acting in front of them daily in the home. After observing, after getting their age in high school days, the children starts insulting the parents. That is platina and scorpion. And waking from least noise. This we may encounter. When you ask about the sleep, the patient will say, I'll be sleeping, sir, but if there is any noise in the home, the sleep will be disturbed. If there is any shouting of the dog from the next door, I'll get disturbed from the sleep. Or if there is any slight noise from lizards or from any kind of thing, or any tap, running tap, if they're not properly off, shut it down the tap, there'll be some noise of dropping of water. For that also, there will be waking from the sleep. That is waking noise from leaves, acquired and next to me. You can think. Hears everything in sleep. Sleep, semi-conscious, hears everything. There's a wonderful rubric in the repertory. Sleep, semi-conscious, hears everything. Asaram, belladonna, coffea, ignitia, mug salt, and sulfur. Please correlate to the clinical condition. Please make a totality of the case. Then consider the remedy. And irrational fear of contamination. Irrational fear of contamination. Anything that is fear dirt of. Arsenicum, carcinosin, tuja. Tuja is a wonderful remedy. Fear of contamination. Fear of dirt. There is a rubric called as fear of dirt. And artificial behavior designed to impress others. Affectation. Wonderful rubric. There's artificial behavior designed to impress others. You may see in this kind of things in teenage people, teenage boys, teenage girls. They'll impress. If the boy wants to impress girl, he makes some artificial. We can think of affectation. The two remedies which comes out is platina and stramonium. And there is another direct rubric. It is related to cardiac complaints, atrial fibrillation. There is a rubric in generalities, pulse slower than the heartbeat. Pulse, see wonderfully how they are written in the repertory. Pulse slower than the heartbeat. It is atrial fibrillation. Kali iode, digitalis is a very wonderful remedy. I have used it in a lot of cases. I would like to prescribe digitalis 30 in these kind of conditions. You will definitely get the result. Kali iode, digitalis, kali nitricum, natrium, Sickelcor. And trying to attain the property of neighbor. In Kannada, we call it as kuhaki. There is a word kuhaki, that is envy. Trying to attain the property of neighbor. If there is any empty site beside his home, and this man is a envy, he'll try to attain the property. That is envy. Helleborus, lycopodium. If you observe this kind, nobody will tell you this. Nobody will tell this rubric. We have to observe. We have to observe and learn materia medica in and around our environment. Then it is it's very enjoyable. The materia medica will be enjoyable if we try to observe these kind of things in our environment. And cough with organic heart disease. Cough with organic heart disease. There is a rubric, cough sympathetic. Cough sympathetic. Lachesis, nausea, and phosphorus. Let's move on to the next slide. That is, person dislike other caste and communities. Extremist. Misanthropy. What he called as misanthropy. Person dislike other caste and communities. Misanthropy. 3 major remedies: anacardium, natramcar, ledum. And excessive sleepiness. Sleepiness overpowering. There is a separate rubric, sleepiness overpowering. Nux moscata, antium tart, and opium. And febrile convulsion. This we may get in the clinics. If the parents present with the child having fever and having convulsion, that is febrile convulsion. convulsion, heat during. There is a rubric, convulsion, heat during. Belladonna I can think of is a very good remedy. I have used it. Belladonna, Carbovex, Simex, Naxomica, Sepia, Stramonium, Veratrum. So the major remedies. And there is a clinical condition rubric. Oxalate crystals in urine. If you see the urine routine report, then in the urine they say oxalate crystals present. There is a rubric in the repertory. That is the beauty of our repertory. Urine sediment, oxalate of lime, nitric acid is the leading remedy. Nitric acid and Rubia tinctoria. Rubia tinctoria. Oxalate of lime, urine sediment. And prickly heat. In the summer, this is a very common conditions. Prickly heat. There is a rubric called as skin eruption, vesicular pseudomina. That is prickly heat due to summer. Natrium, Rustox, Aconite, Brania. Natrium is the leading remedy in this. You can also think of Rustox if there is any reddish rash with itching on the back or elsewhere in the body. And also you can think of Brania if there is any dryness associated with it. This is a very important word. Pseudomina, skin eruption, vesicular pseudomina. That is prickly heat. And recurrent abscesses. With the patient present with the symptom of abscesses recurrent, sir, lot of abscesses there, but it used to recurrent. It used to come and go. It used to come and go every month or every 3 months. That is recurrent abscess. In generalities, there is abscesses recurrent. The major remedies are arnica, pyrogenum, sulfur, syphilinum. Pyrogenum acts very well. Pyrogenum and syphilinum. And skin becomes thick after excessive scratching. Patient will complain, sir, after scratching, the skin becomes thick, sir. That much I will scratch. So severity of scratching is that the scratch very much, the skin becomes thick. Yes. That is skin thick scratching after. Graphitis and Rustox. If there is any discharge, water discharge or honey-like discharge, the PQRS symptom comes to graphitis. There is no discharge, only reddish eruptions. We can think of Rustox. Skin thick scratching after. And this is a very, very important, very common symptom you may see in school going children. After having new shoes, new sandals, recurrent. If you have to confirm, every time if they buy any new shoes or there is any new pulse. Rubbing the shoes, there is a rubric that is veratrum. You can think of veratrum. And there is tubercular abscess of the knee. In the extremities chapter, abscesses, knee, gonarthrosis. That's the rubric. Abscesses, knee, gonarthrosis. That is calcarea, silicea, arsenicum, iodine. It has to be confirmed that abscess is tubercular in nature. Tubercular abscess of the knee. You can think of silicea, ars, calcarea, iodine. And this we can also encounter in the clinic. That is always a feeling that something he had forgotten. These kind of things will complain, will get in the clinic. Sir, something other thing he'll get forgot. Always a feeling that something he had forgotten. Mind forgotten, something feels constantly. Okay. Iodine, tuberculinum, silicea. Sir.
Yes. I think we can finish now. It's 8:45.
Yes, sir.
Then
one more slide.
Yes, I think you can have another session in the 17th of June. Are you free?
17th, sir.
Next Saturday.
Next Saturday. I may, sir. I may take it, sir.
Yes,
I'll confirm it tomorrow.
Yes. So it is provisionally announced. It will continue in the 17th of this month. Provisionally.
Yes,
nice
sir.
presentation, excellent one. There is no doubt about that. When you are presenting, everybody is expecting a lot from you because you have the potential, you have got the potential. We hope that there are thousands of Gurukirans in the world for developing homeopathy. So it's time for discussion. Those who would like to participate can go to the participant list and raise your hand. Very nice presentation. A lot of informations. In fact, it was pouring in. There is beyond the capacity of the GB of our brain. That's the main problem. You want to add something, some new memory cards to the brain. If it's possible, that will be definitely a good thing. Then you said about a couple of rubrics that has got some social relevance, especially ailments of punishment.
Yes, sir.
That's the most important thing, because in this era, a lot of ladies are involved in crimes and they were sentenced to jail, and so many families are collapsing. In that stage, definitely the children, they become, nobody's look after them. They have to go to this orphanages where they will definitely face all these things. So in the coming generation, I think these medicines are very important. Ignatia, Staphylococcus and carcinosin may become the medicine of the next generation. So wonderful rubric. Then another thing is, wife always abuse husbands. Even though there is women commission, a lot of persons are always coming up with this eve teasing. This is also a major part, but nobody is complaining. That's a major thing. And you said about the medicine platina, the scorpion, then irrational fear of contamination.
Yes, sir.
Fear of it. Yes, of contemporary importance, because you know the use of this sanitizers. You must use this way, that way. A lot of explanations, often of no use. But that did create some sort of psychosis in the society. Definitely, that will also benefit others. Then you mentioned about how to convert the classical rubrics into the pathological language, especially the atrial flutter of heart, the digitalis.
Atrial fibrillation.
Yes, fibrillation. That's the most important thing.
In general, it is pulse slow.
Yes, that's good.
After
Intelligent.
It's a very good conversion, sir.
Yes, very, very much. Which report do you have for all these things? This complete.
Sir, there is a complete Murphy-Kent.
Yes. Okay. So it's a time to discussion. As we expected, who is the first person? No doubt it will be Dr. Hariharan. Sir, please. We are very happy to welcome you, sir. Yes.
Okay, Dr. Gurukhiran.
Yes, sir.
Okay, good evening. Say, your class is very nice. I know that it will be very good also. Very, very good. I think it's so. You have done wonderful work.
Thank you, sir.
Wonderful. See, the desire to be magnetized. I think phosphorus is one of the medicine. So, is it correct? Phosphorus.
Yes, sir. Phosphorus comes there.
Phosphorus comes there. Then another medicine, see, fear of microbes.
Fear of microbes.
Fear of microbes. See,
Okay.
that is, you said that rubric in another way, that I think calcaria is one of the best medicine. Fear of microbes.
Okay.
Almost all you said is very, very correct.
Yes, sir. Because I would like to explain the clinical conditions, sir, so that it will be very easy and it will be connecting. If I also explain the same pattern, how the patients present in the clinics, that will be more useful as a physicians. That will be the common presentations in your clinic, so that it will be easy to convert the patient language into rubrics. That was my aim to this session.
Yes, and of course, IFPH is not only connecting homeopathy physicians and homeopathy lovers, but also connecting generations. That's what we are witnessing. Nice. Then I think the point you said about this, the acid phosphoric acid diarrhea, I think this is non-debilitating kind of diarrhea. Am I right? But you said about weakness in diarrhea.
Yes, sir. Yes, sir.
I think the acid phos is the non-debilitating kind of diarrhea, I think. If my memory is correct. Hariharan, sir.
Yeah, it is correct. It is correct. Non-debilitating area. It is acid phos is very, very correct. Another thing I like to mention, see, for euthanasia in boric, arsenicum is the medicine.
Yes, sir. Arsenicum is also comes, sir. Yes, sir.
Comes arsenicum.
But carbohydrates has got the efficiency to revive the case also. Also called as corpse revival. Carbohydrates also called as part of survival. But in extreme conditions, where critical condition is very critical, infirmity is not matched properly. Yeah.
Correct.
Yes.
Should be very much
Nice.
when we're using it, and also arsenic.
Yes. Then I think an important rubric you said about is wandering persons, no residence.
Yes, sir.
That
Vagabond.
one, the medicine was
Vagabond, sir.
yes,
Vagabond. Pyrus corpus.
Pyrus corpus. Yes. In fact, this is a synonymous term for God. It is called Anigedan. He has in having God no residence. In fact, I am remembering that thing. It's called Aniged.
Okay.
Another term for God. Yes. Having no residence. It is everywhere. He is everywhere. He's here. He is there. He is everywhere. So that's another interesting thing. Anyway, nice presentation. If anybody would like to have some, yes, Parisa, how do you observe the presentation of this talented young person? Dr. Gurukiran, yes, we need some assessment from you. Yes, sir.
I have been watching and listening to his professionalisms and deepest appreciation for his presentation today with the topmost relevance and practical orientation, especially in the present context. I think we would like to have more presentation from his guru. I really call him as guru, even though your name is Guru. Thank you. All the best, and you made an excellent presentation. No doubt about that. Everybody, I am not a homeopath, but like a homeopath lover. A very simple way of presenting things that will be available for people like me and ordinary people. I fully appreciate you, Dr. Kurian.
Thank you, sir. Thank you very much, sir. Thank you for the blessings.
Yes, that's now Taciturn Illyria there. He's also a homeopathic lover, an engineer by profession. Taciturn, are you there? Taciturn Illyria.
Good evening.
Yes, sir, please.
Yes, I'm here.
Yes.
The presentation is very interesting. So it is hard to find in many places, and looking and searching and finding these rubrics really hard. Thank you very much.
Thank you, sir.
Thank you. That is Taciturn Diary. He's also engineer from profession. He's regularly attending our IFPH. These are the strength of this great organization, this ardent organization, IFPH. Now, Dr. Dhanesh, our dear coordinator, who is coordinating all this, is connecting everybody, like BSNL. Yes, Dr. Dhanesh.
Thank you, Dr. Manoj. And good evening, Dr. Gurukiran. It's really a very
Good evening, sir.
really a very good presentation, because this is what the need of the hour, to motivate our homeopathic doctors to choose the right remedy in the shortest possible time. You have come across with the deep knowledge in this so-called rubric selection, and how to convert a symptom as from a patient to a rubric. That is something. For example, the medicine for shaping. The patient is usually people used to say like that, Doctor, I cannot comb my hair in a very good way. Whenever I try to this goes this way, that way, or it curls here and there. So how can I, is there any medicine like that? Usually this is one of the questions. Usually younger stage, not only younger stage, but even ladies above 40, I used to ask. And here we have a solution in homeopathy, but how to find that solution? That is something usually people may think of, oh, we can have arnica or calcary force or all these things that can do a little bit, but there is specific medicine, a specific rubric. That is what you have shown. This is something, an extra knowledge, just like that. You have shown as just like just before Dr. Manoj pointed out ailments after punishment, and
Yes, sir.
usually people may think that the punishment may require not only for these children but also for the the person who really affected. And in both cases also we can use the same remedy, but in a different situation. This is only those who go across and find out the deep into the case, then only you will get these kind of things. And whenever a patient used to come to your clinic, they don't open up the mind. But when the doctors sit just like a friend and ask so many questions, just listen, and they are ready to share everything, and then we will be able to find the rubric, just like what you narrated here. So sometimes we may have prejudice view on some cases, but when we sit together and find out the solution, we may find different symptom and different rubric. I would like to know about usually there's a child. The child usually try to prick her vagina, just 5 years old.
Okay.
And it happens once during a fever, and thereafter she used to do this and even try to do these things in front of others also. And sometimes she may rub this part in the corners of these chairs and like that. Sometimes we can convert it into masturbation in children. But is there any specific?
Sir, lachesis, sir. Lachesis is one of the very good remedy for this condition. I have treated 2 children cases like this, sir. Lachesis works wonders.
Yes, what can be the reason you find in those cases? Because the parents are quite happy, but they are worried about all these things.
Yes, sir. It is just some what we say, a small pleasure feeling.
Yes.
Yes, maybe.
They don't know exactly what it is.
Yes, Dr.
Maybe some
GURUKIRAN,
pleasure.
we have to finish in time. Yes. Okay. Now
Yes.
may I invite Dr. Veena to express sort of thanks. Dr. Veena. Please unmute, Dr. Veena.
Yeah, good evening, sir. Good evening to everybody, one and all present here. Sir, you are a best teacher, I would say. So you have given great insights for us to convert into rubrics. Though we are aware of so many rubrics, but application is a big toughest part for everybody, I'll say.
Yes.
Only by experience we gain that knowledge. And
Yes.
we are addicted to, each one is interested or addicted to a particular repertory. So a wide range of repertories are there, but we are unaware of where to hunt what. So in that way, it is really very helpful. I would like to request you to add whether these rubrics belonging to which miasm also. That would help us in taking the totality and ending up in a correct remedy
Okay.
for everybody. So I would request you in further classes, please add on your thought process on whether
Miasmatic.
miasmatic
Yes.
aspect for each rubric.
Definitely,
you
yes.
should continue this, doctor. Apart from cases, we would require these classes also.
Okay.
We're very thankful to you. So I express sincere gratitude on behalf of IFPH and on behalf of my own this thing. Thank you. Thank you, Gurukiran, sir. Thank you so much.
Thank you. Thank you.
Very nice presentation, absolutely professional one. So with that remark, let me conclude today's English session. Hope you to meet the same day tomorrow. Till then, goodbye. And it's all Dr. Thanesh for continuation program in Malayalam.